Good morning, I'm Dr. Farzaneh Haratian and I'm going to have my 8th talk on ethics. Today I'm going to talk about forensic and child protection laws. Previously we talked about psychology and ABA Act, and today this is the focus, the Children's Law Reform Act, CLRA. It governs custody and parenting arrangements in Ontario when parents are not divorcing. Unmarried parents, same-sex parents, separated couples. The key is Section 24. The best interest of the child. The Act lists factors including the child's emotional, physical, and psychological safety, the child's views and preferences, given appropriate weight based on age and maturity, the ability of each parent to care for the child, the impact of family violence, and cultural and religious upbringing. Important, there is no presumption of equal parenting in Ontario. The child's best interests are paramount, not a 50-50 split. Family violence is defined broadly in Section 25. It includes direct and indirect exposure, controlling behavior, and psychological harm. So the CPBAO document from 2014 is critical for anyone working with children, not just family law practitioners. The key role: do not be both therapist and custody evaluator. That is a dual relationship and is almost always unethical. Therapeutic role: client is the child or a family. Goal is treatment. Confidentiality applies with limits. Role is supportive. But in forensic role, client is the court. Goal is objective evaluation, no confidentiality. Role is neutral. You cannot wear both hats. The APA custody guidelines from 2022 are American, but considered best practice in Canada. They emphasize that the psychologist is a neutral evaluator, not an advocate. Multiple data sources must be used. Domestic violence must be assessed. The child's perspective must be elicited. Part 20.1 of the Criminal Code governs mental disorder in the criminal justice system. Two key concepts: unfit to stand trial. The accused is unable to conduct a defense due to mental disorder. They cannot understand the nature of proceedings or communicate with counsel. NCR, what is it? Not criminally responsible. Under Section 16, at the time of the offense, the person was suffering from a mental disorder that rendered them incapable of appreciating the nature and quality of the act and knowing it was wrong. The difference is timing. Unfit is at the time of the trial. NCR is at the time of the offense. Court-ordered assessments under Section 672.11, a psychologist can be ordered to assess an accused. The report goes to the court and the review board. Review boards are independent tribunals that oversee NCR and unfit accused. They can order absolute discharge, conditional discharge, or even detention in a hospital. Youth Criminal Justice Act applies to youth aged 12 to 17. It is a federal law. Key principles under Section 3: prevent crime, rehabilitate youth, ensure meaningful consequences, protect the public. Rehabilitation is a primary goal. Consequences must be proportionate to the offense and the youth's degree of responsibility. The least intrusive measures should be used. Custody is a last resort. Extrajudicial measures, warnings, cautions, referrals are preferred over formal charges. Psychologists may be asked to conduct pre-sentence assessments under Section 34. These assess the youth's needs, risks, and treatment recommendations. Here are the top 3 exam traps for week 5. And what is the trap now? Candidates think equal parenting is presumed in Ontario. No, it's not. The best interest of child control. Candidates confuse being a therapist with being a forensic evaluator. You cannot be both. Candidates confuse unfit to stand trial. Time of trial with NCR, time of offense. Know the difference. And for the next week, assessment, testing, and educational law, we're going to discuss the standards for educational and psychological testing, the Education Act, and registration 298 of 90, FIPPA and MFIPPA. Between now and then, memorize the difference between therapeutic and forensic roles. And remember, custody is not presumed equal in Ontario.